We, as European nations and American nations, have not really taken it seriously until now, when it, of course, is starting to affect us.
There's been a terrible inequity in vaccination rates. The distribution of vaccines around the world itself, the availability of the vaccines, is incredibly unfair.
Vaccine inequality between Europe and Africa is very clearly happening again with monkeypox, as was with COVID. We have vaccines in Europe and America and existing stockpiles to deploy for slowing the rate of infection or the spread of infection and morbidity. But in Africa, these vaccines just simply aren't available. Are we being selfish with regard to vaccine distribution and tackling diseases in underdeveloped countries? In essence, yes. European and American nations need to provide assistance, both for surveillance, diagnostics.
These are diseases that have gone largely unnoticed globally in Africa for many years. But as soon as they're found to be a threat to the parts of the world where there are more resource, where there's more wealth, then suddenly resources are mobilized to deal with them in those countries. Our biggest concern of all is that we will continue to allow health systems in some parts of the world to be so much stronger than they are in the areas where they're almost non-existent.